But already lots of developments on the COVID vaccine front. From Wednesday, the over 12s can get the jab in South Africa. Also news today, the Russian Sputnik COVID vaccine has been denied authority here due to concerns that it may increase the risk of contracting HIV in men. Let's discuss this and other COVID news with Wits vaccinologist Professor Shabir Madhi. Prof, thank you so much for joining us. So the health products regulator has not approved Sputnik for use in South Africa. I wonder if you could please explain the concern that it may increase the risk of contracting HIV in men. I don't understand how a vaccine for one virus can make you more vulnerable to a different virus.
So good evening, Sally. So the main concern here is based on a study that was done on an HIV vaccine, which used the same vector known as adeno5 virus, which is used in a Sputnik vaccine. And in that particular study of an HIV vaccine, the participants, and particularly the men that received the vaccine, they ended up having a higher risk of being infected with HIV than the group that received the placebo, the control substance. So the concern here is that it's something that this adeno5 virus that the vaccine might be stimulating, an immune response it might be stimulating, that paradoxically increases the susceptibility of individuals to become infected with HIV. The reason why SAPRA probably disallowed the use of Sputnik 5 is that it's not to say that the vaccine definitely would cause it, but on the other hand, the Sputnik 5 itself, the company that markets it, needs to actually provide the data to indicate whether or not it is a concern for that vaccine, and that data hasn't been provided, and consequently, SAPRA is not in a position to probably approve its use in absence of the company providing that sort of data.
All right, so is that probably why Sputnik's not on the WHO emergency use list as well?
No, that's another reason. The WHO process is completely separate, and companies are expected to present the data to WHO. The WHO Scientific Advisory Group of experts then interrogate the data and make a recommendation. At this stage, the company that produces Sputnik 5 hasn't actually presented any data to WHO and hasn't asked WHO to consider it for approval.
All right. I want to move on to the fact that we're going to open up vaccinations for 12-year-olds and up, I think, from Wednesday. I have to ask, and I'm asking you a question as a parent yourself, because I think when considering these issues as parents, you want to hear from a scientist who also understands what it is to be a parent. Are you going to vaccinate your own kids?
Absolutely. I've got an 18-year-old that's already been vaccinated. I've got a 16-year-old who I very much will take for vaccination. So it is safe to vaccinate children. But at the same time, the question right now is whether children should be a priority. And certainly the 12 to 17-year age group are not necessarily a priority, particularly in a country such as South Africa, including from a global perspective. In South Africa itself, you need to understand that the manner in which we weather the next wave is more based on what percentage of the high-risk group, especially people above the age of 55 or 50, are vaccinated. We're needing to get 85 to 90% of people above the age of 50 vaccinated. Starting to vaccinate children is going to have a very nominal public health value and very little by way of individual protection. So we also need to ask why are we vaccinating children right now? But from a global perspective, the other concern is that once countries start vaccinating children, effectively what they are doing, unfortunately, is depriving access to vaccines for other low-income countries, where currently only about 2.5% of the population have been vaccinated. And the reason for that is that there isn't enough vaccines flowing to those countries. So I'm a bit surprised that government has taken this position right now, and particularly since they're only planning on using a single dose of the vaccine, which itself diminishes the ability of the vaccine to actually protect against infection in that 12 to 17-year age group, which is the main focus of the vaccine use in that particular age group.
So what I'm hearing you saying is if we're going to do it properly, give them 2 doses, or send those vaccines to neighbouring countries who are still battling to access vaccines. You don't subscribe then to the view that it's actually quite a good idea to vaccinate even children who might be around vulnerable people, you know, that they might go home to the granny or the grandpa?
Absolutely not. In fact, what's more important and what will be of greater value is to give those grannies and grandpas a 3rd dose of the vaccine rather than using a vaccine in a child 12 to 17 years, because the direct impact of the vaccine is much greater than the indirect impact of the vaccine. And we do know that people above the age of 65 particularly, and others with some other immunosuppressive conditions, they do actually require a third dose of vaccine. So right now we should be prioritizing third dose of vaccines for people above the age of 65, people with underlying immunosuppressive medical conditions, as well as for healthcare workers, and particularly those healthcare workers that have only received a single dose with the Johnson & Johnson vaccine.
Yeah, it's interesting because Johnson & Johnson in the US, I think they've approved the booster, but here in South Africa, they're saying that they don't think only immunocompromised people need to get that booster. Do you think that that the Department of Health is being too slow on this booster decision? Should they have already made the decision on boosters for the immunocompromised, for the over 60s, and for health workers?
So for healthcare workers, it's long overdue. That booster dose of vaccine probably should have taken place 3 to 4 months ago. And certainly the healthcare workers definitely should be boosted before the end of November, before we experience another resurgence, which is expected sometime in December. And it doesn't necessarily need to be the Johnson & Johnson vaccine. In fact, the Pfizer vaccine as a booster to the Johnson & Johnson vaccine probably works better than a boost for the Johnson & Johnson vaccine. As for the other groups that you mentioned, the reason we're wanting to boost them is to enhance the protection even against severe disease. And for them, the WHO just came out with a recommendation more recently in the past week, which recommends that countries seriously consider a third dose of vaccine for those above the age of 65. And as you mentioned, those with other underlying immunosuppressive medical conditions.